Okay, so I do want to welcome those who have joined thus far for the Master of Science in Health Systems Management Engineering. Thank you for joining us this morning here in Los Angeles, late morning. My name is William Schwerin, Director of Graduate Recruitment here at the Viterbi School of Engineering. I'm pleased to be joined today by the actual program director of our Master of Science in Health Systems Management, Professor David Belson. He's joining us today. So I'm going to start our webinar now and actually just give an overview of our university if you're unfamiliar with it, and the Viterbi School of Engineering, and then ask Dr. Belson to explain more about the program, and he'll go through his slides. Dr. Belson, I can go ahead and move your slides forward. So you just give me the prompt and I'll move them forward when you're ready.
Sounds good.
Okay, great. So thank you for joining us today. Just a little bit about the current state. The university is back in pretty much full swing of things as of July. COVID restrictions lifted in California, and we kind of adhere to the County of Los Angeles and the state of California, any restrictions that they have. But the university actually is back on campus. It's nice being around all the students, and there are still, COVID restrictions kind of in place, like you have to do a wellness check and things like that for students. But more or less, classes in session. We're great to see that. So USC, welcome to the University of Southern California. A little bit more about the university in a general sense. We are located in Los Angeles. We're a private institution. One of the unique things that I like to tell students is, while we have a large student population, about 44,000, we actually have more graduate students than undergrads. Our graduate student population is about 24,000. In contrast, our undergraduate student population is only about 20,000. And I think that's nice, actually, at the graduate level, especially, to know that you're going, to an institution with a large graduate contingent and student peers, all around you, which is nice. So I tell students, chances are you're walking on campus, you see someone across the quad, you have a 50% chance that they're another graduate student, which is kind of nice. We have a lot of research at the university level and within the School of Engineering, and we just attract a lot of top talent throughout the world to pursue graduate studies. So yeah, a little bit about Los Angeles. Our students love it. I always tell students it's a great place if you're a young person to actually experience, if you've never lived in a big city before, because there's so much opportunity, not only within the university, but outside of the university as well. There's just so much for you to do, whether you like hiking, even skiing, snowboarding, all of that is, pretty accessible. A lot of students just like to eat. Los Angeles is a great place for foodies. We have chain restaurants, but we also have a lot of individual restaurants as well that are really top notch, and food from all over the world. That's relatively easy to access from where we are located. And our location is very close to downtown Los Angeles. We're just a couple miles down the street from what's technically considered downtown LA. Los Angeles climate is very moderate. We counted 292 sunny days out of the year. Right now it's beautiful outside. I'd say it's maybe 75, 80 degrees. But again, there's so much happening and so much opportunity. We have a large aerospace hub in the area, technology-wise. A lot of the companies from the Silicon Valley have realized how beautiful it is down in Southern California, and they've opened offices along the beach, and they call it now Silicon Beach. So we're very close to not only Silicon Valley, but a little bit further south, San Diego, which is a big on the biotech hub side. In addition, Las Vegas is maybe a 3 to 4 hour car ride. So there's a lot of things for students to get involved with and do outside of the university setting as well. Within the Viterbi School of Engineering, I'm going to show, my slide, I apologize for the numbers on the slide. They kind of got jumbled, but I'll walk you through it. So similarly, at the graduate level within the engineering school, we have more graduate students studying than undergrads, about 6,200 total graduate students. That's a combination of our master's and PhD students. We have about 1,000 PhD students. The remaining balance is our master's student population. Now, not all of those students are on campus. We have 20 to 25% of our master's student population are actually online students. They're working professionals, earning their degree while being employed full-time usually. So that is one of the strong selling points I think we have, and I'll talk a little bit about our online program shortly after Dr. Belson talks about the health systems management program, the nuts and bolts of that. Within the engineering school, though, we have 8 academic departments. The department that this program that you're here to learn more about, it's within our industrial and systems engineering department. Okay, and if you like to look at rankings, we go kind of in and out of the top 10 annually by US News and World Reports. Currently, we're ranked 12th. So that pretty much does it for this slide. What I want to do now is hand the wheel over to Dr. Belson, where he can talk about our Master of Science in Health Systems Management Engineering.
Okay, thanks, Bill. Thanks for the opportunity to talk about this program. I'm very excited about it, very happy with it. It's a new program. We just started it, first cohort this semester. And we started thinking about this a couple years ago, 2 years ago. And one thing that impressed me early on, I thought was indicative of the whole idea, was talking to a CEO of a very large hospital about this kind of degree program we were thinking of. Would this be of interest to you to hire people from this program? And he said, oh, absolutely. He said, absolutely, we're looking for such people. He said, but really what we need people that would come from this program to train other people at our hospital. There's no way we're going to hire enough people doing this kind of work, but if we get a few of them at least, they can train others. So what we're talking about here, a Master of Science in Health Systems Management Engineering, is training people to make healthcare work better, to improve performance, to make healthcare more available to everybody who uses healthcare, which is everybody, make it more efficient, make it more effective, provide better care, provide better quality. And so it's a degree focused on what hospitals tend to call performance improvement. It goes by other names as well, but the idea is to help redesign the healthcare system, not necessarily the whole system, but various pieces of it. So people with this degree work primarily for healthcare providers, but not only. I'll talk about that in a minute. But they work on making things work better. And someone's told me recently, there's 2 things, at least in America, that are really complicated and really need to be fixed. One's the educational system and one's the healthcare system. It's just ridiculously complicated and doesn't need to be. So that's what this degree is focused on. And it's serving the world's largest industry. Several different studies have indicated this is the biggest area of employment. Healthcare is in every city. Wherever you live, there's some healthcare, from the smallest town to the largest. I've been working in this field for about a couple decades. A little bit about me. I'm an industrial engineer, as Bill mentioned. That's the department I'm in. I'm an industrial engineer, and I work solely with healthcare, all different kinds of healthcare organizations. And I do a lot of work with rural hospitals, small hospitals, but also the large ones as well. I've worked for the VA and other healthcare systems. So there's a lot of different employers as well as a lot of employment in the healthcare industry. I want to go to the next slide. The other thing that also kind of impacted us once we got started with this program, obviously the pandemic, which has changed a lot of things. It's really, if anything, made what was a good opportunity a better opportunity. The pandemic, I'm sure you've read and seen and had headlines every day, including today, how the pandemic is really stressing the healthcare system. We need it more than ever. And that's what the graduates of this program are involved in, is increasing the capacity so more can be done, so it can be more effective. Uh, People working in this area and also our courses involve some of the new things that the pandemic has triggered. You may have used or at least heard about telemedicine, where people get their care outside the hospital. And so we're working in that area. Had a colleague in performance improvement been working with the vaccination programs around the country. The pandemic has changed healthcare, but it hasn't reduced the need for making it work better. The supply chain, the availability of supplies became a problem, and this is certainly what industrial engineers do. And so staffing, getting the most out of people. Number of studies have shown that healthcare, certainly in the U.S., is extremely wasteful. Something around 40% of the cost and labor in healthcare is waste. It's simply not needed. So one of the things we work on in performance improvement is getting more out of the staff. Not a matter of reducing the staff, just getting more care done and eliminating those wasteful steps. So there's a lot of changes happening in healthcare, technology, ability to care for people at a distance, all that sort of thing is involved here. So next slide. Um, so in terms of the degree itself, certainly can provide you more detail on the curriculum and what have you. But we take courses in this area. I need to mention that this degree, while Bill and I are in the engineering school, it's not just from the engineering school. The degree is offered from 3 different schools at USC. It's from the Viterbi Engineering School, but also from the Keck Medical School. Keck is one of a leading and large medical school at USC, and it also operates a number of hospitals, some of the biggest hospitals in the country. So the degree comes from the engineering school, from the medical school, also the Price School, Public Policy School, which provides courses in healthcare policy, healthcare management. So the courses are from 3 different schools, which is very unusual. Usually almost all degree programs are only within 1 school, but this is from 3. So so the courses include, of course, performance improvement, how to make healthcare work better, but also courses on quality. It's of course a priority in healthcare is making sure that patients are safe and properly cared for. One of the most important things is leadership, how to lead projects, how to lead change, how to make change happen, which is one of the ingredients probably because many people from this program go into management. So there's that aspect of it, courses in that, courses in project management, computer technology. Also, we have the students do real projects in hospitals. I currently have about 30 students. They're all doing projects at hospitals. Hospitals come to us for help. And so we give the students hands-on opportunity to work in surgery and emergency rooms and clinics and technology, all that sort of thing. So there's certainly a hands-on component in this project. It may involve, in terms of electives, different areas. Maybe you get involved in more into the IT area, or perhaps into technology aspects, all that sort of thing. So there's a variety of different electives available. Some people are more interested in the clinical areas. Some are more into data and analytics or the business side of things. So the degree program includes courses from all these 3 different schools. And the products of the student work is also used by the hospital. In many cases, because there's such a shortage of people in this area, the hospitals hire people that were working as interns on their project. And again, this is coming from 3 different schools. So next slide. I said that this is a new program, and it is. We just started the first semester with a cohort of students this fall. There was a version of this offered about 10 years ago, 8 to 10 years ago. pretty much a similar program. And I'm still in touch with graduates from that program. So um, they're available to help. They come and speak to classes, all that sort of thing. So there are some alumni, and they have gone into a variety of different kinds of jobs. Many of them gone into management. Some have gone into consulting. Some have gone into startup businesses. Um, One person I was talking to the other day, she got this degree, or she worked in this performance area uh, um, more than a decade ago at a kind of entry level. Now she's the CEO of a hospital. So many of the people go into management, but not all. Some have gone into tech, some have gone into consulting, some have stayed in the performance improvement area because they find it kind of a satisfying career. And in terms of the degree, you can see in the materials on it, the background requirements is really any Bachelor of Science degree, whether it's from engineering or from science or economics or business or any of the Bachelor of Science degrees. It would certainly make it feasible for you to pursue this degree program. Let's see, next slide. So I guess I've described what might be some of the career opportunities. Um, there's also quite a bit of opportunity in the tech area, if that's what you're interested in. It certainly helps to know just how healthcare works. In some ways, healthcare is unique, but in other ways, healthcare is not unique. Some of the problems that other service industries experience, scheduling staff, dealing with consumer objectives, figuring out how to have satisfied customers, all the things from a service business are also involved in healthcare performance improvement. The performance improvement also is of interest in a number of government agencies. Healthcare is, much of it is pretty regulated and supervised by a variety of agencies, and they also hire performance improvement people. And so, well, anyway, that kind of covers the overall view of it. Perhaps Bill, share my email. I'd be happy to talk to anybody who has questions about the program. It's turning out to be one of our more successful programs. Oh, I should also explain, in terms of the classes, maybe Bill is, I hope I don't jump the gun here. As Bill was mentioning, we've gone back into in-person, face-to-face classes, but we also have classes, the same classes available on an online basis. So I have students, for example, in my class, I have about 2/3 of the students are in person. They come to class face to face, and about 1/3 of the students are online. Some are um, not far from Los Angeles, some are international. But we're still able, amazingly, to do, for instance, the projects I was talking about with teams of students for both online and in person. So it's definitely a feasible online kind of program as well as an in-person program. So,
Yeah, that's. I'll
good.
actually jump to that. What Professor Belson is speaking about is we call it DENA-Viterbi. It's an acronym, Distance Education Network. The nice part about this is while there are the classes that are taking place live on campus, the classes are live streamed to our online students who can watch live. They also get recorded. And so how that works is essentially is a student in the class, they won't have access to watch it live online because they have to be in the class. But the nice part about it for all the students, whether on campus or online, is that recording of the footage. So what happens, students can go back and watch the archive of the recording as many times as they want. So especially during like midterms, finals, that becomes really valuable study tools. What I like to tell students who are on-campus students, if you are in one of these courses that has a DENA-Viterbi component, basically that is being live streamed, you can actually sit in class and really try to absorb the material as opposed to try to listen and then scramble to take notes at the same time. You can just sit there and try to absorb it, then go back and watch the lecture again and take your notes based on that. So I think it just, with the learning process, is really valuable for students that we have this, and especially that this program is one of our programs that is available online for the working professional. Just a little bit more about the Dennett-Viterbi program. In addition to this, we have a number of other programs kind of as we spoke about, and it is a very highly ranked online program. We've been doing it for decades in an online setting. And so we've really been able to really sharpen the experience for the students who are a part of this online environment. I want to touch on our master's programs, just kind of on an overview setting. So the difference between online on campus, I kind of spoke about in terms of the delivery method. But for an on-campus student going full-time, you can complete the degree in 1.5 to 2 years, okay? So our master's programs are course-based, so we don't require thesis. That is optional for students who may want to do a thesis, but in order to earn the degree, you complete all the required courses with a 3.0 GPA or better. What we look for, and this is going to, ask Dr. Belson to speak about this a little more, because this is on the general sense what our application requirements are. This program is a little unique. In one of the slides previously, it said a background in any Bachelor of Science degree is possible to apply for this program. So it's definitely more broad and open for, and not as narrow focused for an applicant. In order to apply, it's just the online application. And we just recently do not require the GRE. So this is actually not a requirement now. Oops. We will need official transcripts. The nice thing is all we need at the application stage is you to get the official transcripts from any coursework we've taken after high school, so any university or college you attended. We need those scanned and then uploaded into the online application. So you don't have to physically mail your transcripts to us, okay? That's unique to the Viterbi School of Engineering. We just require you to scan your official transcripts and upload them into the application. And it definitely makes things a lot quicker. So you don't have to mail them, wait for us to receive them and upload to your application. In addition to transcripts, personal statement and a resume or CV are required. And then letters of recommendation. I'm not sure, Dr. Belson, do you know if for this program, letters of rec are required?
I don't believe they're required, but of course they don't hurt.
Right, exactly. So if you definitely have, it's really quality as opposed to quantity. So if you have someone who can speak well on your behalf in a letter of recommendation in the academic setting, please definitely do submit. Application deadlines, we admit for fall and spring semesters. Our spring semester begins in January, fall semester begins in August. Our spring application deadline just recently passed a day or two ago. Our fall application deadline, the final deadline as it shows there, is January 15th. However, we do have an earlier application deadline if you want to be considered for scholarships. So we do at the master's level have a limited number of merit-based scholarships available, and this program does actually as well. So if you want to be considered, just be sure to submit all your application materials by December 15th.
Bill, maybe
Yeah.
maybe I'm going to jump the gun here, but you mentioned
Go ahead.
scholarship. This
Yeah.
program is also separately funded, really kind of additionally funded,
Right.
and we have scholarships specifically available for this program.
Yes. Yeah. Thank you for adding that. So because it is specially funded, we have generous donors who are very interested in this program. There is that scholarship also. In terms of tuition and costs, this is kind of general. The university charges, the engineering school charges on a per unit basis. And considering that most programs are between 28 to 32 units, This example provided is a typical 28 unit, which would translate into about 7 classes or so, to give students an idea of the total cost. Keep in mind that every year the university tax on 1 or 2% to the cost of tuition. So this is just more of a general to give you an idea of ballpark cost. In addition to the scholarship that Dr. Belson mentioned for the health systems program, we do have these other Dean's Master's Scholarship, that's the endowed scholarship, as I mentioned, and then Dennet Viterbi students have a Dennet Viterbi scholarship available as well. So again, these are merit-based. There's an interview process involved for students who've been kind of selected if they're interested and have been admitted. So I just wanted to share that with you. Okay, I'm going to skip to these frequently asked questions. Are TA and RAs available for master's students? The answer is not really. Those are reserved for our PhD students. And so they have first opportunity for the teaching and research assistantships. What impact does work experience have on an application? It's not really an application criteria for majority of our programs. There's one program that it is. It's our systems architecting program, but we're really looking at your academic background and coursework. Okay. In the personal statement, this is your opportunity to paint the picture of yourself, really, because we're just receiving documents, transcripts, that talk about your academic experience. In your personal statement, you can talk about yourself on a personal level, help our admissions office get to know you a little bit better and in an overall holistic setting. I'm going to go ahead and jump to Q&A right now. If you have any questions, please do submit in the Q&A box on your screen. Yes, and it looks like we do have one. Yes.
Yeah, there's a question about interning. I think I mentioned it briefly, but there's definitely interning opportunities. In fact, it's kind of excessive. I had 2 requests today, for example, from hospital executives looking for student interns. So there's a lot of interning opportunities. we got a bunch doing interning right now. For example, one is working with, actually, I think it's the largest hospital in Los Angeles area, helping them in the area of performance improvement, working with a group of medical doctors. So there's a wide variety of interning opportunities. Some are paid, some are not paid interning, but there's just, I can't say how much opportunity there is for doing that, particularly for the unpaid interning. Hospitals need this kind of help, and if they can get it without paying for it, they love that. And so the opportunity for work experience is available whether you're wherever you are, really. We're in Los Angeles, but I've done a lot of work around the state, for example, and so interning is available in the San Francisco Bay Area or a lot of the rural communities as well.
With your experience, would a student be able to intern like the same semester they're taking courses, or
Yes.
do they want to? Yeah.
Well, I've kind of been doing it several ways. We've been doing it several ways. One is on a project basis where they do it over some specific time period. I've got several students now working interning. It's kind of open-ended, so that relationship will continue over the course of their time as a student. So different formats, depends on the particular situation.
So there's flexibility, which is.
Yeah, it's more a matter of picking which interning you want to do.
Okay. That's great. I do want to encourage, if anyone in our audience has additional questions, please go ahead and share. So it looks like we did get one. The application portal I'm looking at, there's a deadline for spring is October 15th.
That's true.
Yes, for this program,
correct.
Yeah.
Yeah, so it's longer than was shown in that earlier slide.
Yeah, and in terms of the scholarship deadline for spring, I'm not sure if that will be extended also.
Likely it will.
Yeah, I'll confirm that though with our scholarship. We have a kind of separate scholarship committee. But I do see your question. Anna, if you want to leave your email in the chat. Yeah, if you can leave your email in the chat, and I can get back to you on that. thank you for that question. Okay. Any other questions from anyone? I'm so grateful that, we have the people in the audience that we do who are interested in this program. I'm going to leave my contact information and Dr. Belson's email in the chat as well. Should you think of any questions, maybe after we close this presentation. So let me do that right now. So I hope, I sent it. Let me send it to everyone. Okay, so hopefully if you look on the chat, you can see Dr. Belson's email, and then my email is simply just. Oh, Young Jay, thank you so much for joining. Does anyone, if there are no other questions, then I will go ahead. Anna, I have your info, so thank you for that. And I will get back to you with regards to the deadline. If there are no other questions, I want to thank you for joining us today, and I want to thank Dr. Belson for your time as well to share more about this new program. Any parting words?
No. Hope to see you all, and good luck. Stay safe.
Thank you all. Bye-bye.